parasitosis is a fixed false belief that an individual is infected with parasites. So they believe they are infected by parasites. It's a false belief. You know, false belief is a delusion, not a real true belief. And it is classified as a delusional disorder, and it's described as a monosymptomatic hypochondriac parasitosis. Monosymptomatic, it is one symptom, false belief, and hypochondriasis, it's similar, but do you know hypochondriasis? Can you explain?
Even though there's no evidence, they think there's many health problems, like heart problem.
They're worried about that.
Paranoid.
Yeah, like care about their health. So it's preoccupation with fears of having serious disease. But it's similar, but it's different. So patients with hypochondriasis, their belief is shakeable. Their not easy. It is easy to change. So sometimes they will acknowledge that they may not have the symptoms. It's different because delusional parasitosis is fixed belief. It's not easy to change. And schizophrenia, it is a delusion, but in contrast to schizophrenia, delusional parasitosis, they don't have hallucinations. They don't have any abnormal thinking or abnormal behavior. They just look normal.
Other than
Yeah, other than that.
He brought the bag of lice. That's kind of strange behavior.
Yeah, it's not the only thing. They have delusion.
So it's like he thought there was lice in the bag, right?
Yes.
But there were no lice.
Yes.
So isn't that hallucination?
Oh. I didn't think about it.
You mean diagnosis?
Schizophrenic. Schizophrenic.
He might be.
Yeah.
Good point, man.
So is it defined disease in DSM?
No, I cannot find it.
Right.
It is kind of delusion disorder, so it has only delusion criteria. And this picture is described very well. Yeah,
So
It's very dramatic.
and most patients have symptoms for at least 6 months or some more years before their diagnosis is established. And typically they present pruritus. And because of pruritus, they have excoriations from scratching. And they have a feeling that bugs are crawling on their skin.
Fornication.
So that's called
Ants.
yeah, fornications. And there's matchbox signs.
What's a matchbox
sign? Kind of symptom.
As you heard from MAPA, patients often bring some pieces of skin in plastic wraps or matchbox. They bring it. They believe it contains parasites.
That's matchbox sign.
They bring it in a matchbox?
Yeah.
Wow.
I caught this.
Interesting.
Matchbox sign.
But
Have you never heard of that?
purification
No.
is considered as a tactile hallucination. Then
So
we can say
kind of.
they have some kind of hallucination.
That-
I'm not kidding.
The line is thin. It's a thin line between
Very thin.
delusional and hallucination.
And patients have a history of prior negative evaluations by many physicians. All results are normal. And can you guess the prevalence? Do you think it is
2% of whole population.
2%?
I guess
Okay.
it's high.
Try. Okay.
1.5.
Are we counting drug users or no? Did drug users
Including-
count?
Including drug users.
5%.
10%.
10%.
It's very rare.
In China, though.
In China, really
They
high.
don't use drugs in China.
But they have a lot of lights.
Yeah. You gotta do LA or something like that.
Yeah, but most in the report, most cases have been reported from North America and Europe. But some people say it may be underestimated because patients refuse to see a psychiatrist, so
There's no epidemiologic study in the States.
no. Only China.
Only in China. You both.
Because in China that's strange, but in America it's pretty usual. Doctors are like, oh, you're back.
Okay. Oh, what about the cause? We don't know yet.
Amphetamine.
Neurochemical pathology or substance abuse, or some people say
It's
it's
OCD,
strongly
yeah.
associated with obsessive compulsive disorder.
They're thinking of
Early
Germophobic.
because they're just
Yeah.
obsessive thing.
Yes. Or depression or schizophrenia.
Yeah, I know people with both, some OCD and they think they have bugs, and also substance abusers who think they have bugs. Very similar.
Double.
Very similar.
Wow.
So if they are abusing substance and have OCD,
Yeah,
they're
it's really bad.
big bugs.
Maybe they have
Yeah.
poor prognosis.
Yeah.
Oh.
And as I remember, alcohol.
Also,
Oh, alcoholics feel, yeah. When they're
Maybe the ball in my arm.
what do you call it?
Cut.
Yeah, stopping when they're
Stop
what's the
drinking.
word? I can't remember English. Yeah, withdrawal. Yeah. No, there's another word for that. It's a big word.
Or withdrawal?
Like
Cut.
detoxing or whatever. Right? It's not detoxing. I'll think of it.
Okay. Yeah, we don't know the cause yet, but we are doctors or we are doctors candidates. So we should know how to treat them.
Oh.
True. How can I be approach to this type of patient?
Confrontation.
Yeah, there are two ways.
Reason.
Yeah, confrontation means like that. Yeah.
It's fine.
More like, oh, I think it's in your head.
It's in your head.
If we
Yeah,
if we wrestle and I win,
Let
then
me
you're
find
cured.
a better word to word this.
Do you think it's effective? You tell the patient, oh, you have parasites.
No.
How about
You
giving them
have parasites.
placebo? Because if you keep giving them something that's medicated,
Mhm.
it's gonna ruin their skin and stuff. So just give them placebo and just talk to them. Give them a hug.
Confrontation.
Here, it's okay.
They're using a lot of different drugs, so I don't think they can any placebo effect on anything.
I think you have to do confrontation first. So you have to tell the patient that you don't
It's in
think
your
that
head.
it's head.
My
It's
my
in
idea
your
is
head.
to
Yeah.
say that bug is good for burgers are good for health.
Oh, this is good. It's good for you, man.
That's a protein.
That's a protein.
Just eat them.
Burgers are good for health. To treat your allergy. There's something called parasitic treatment for
I look.
That's a good idea. Recently, I saw a news article which
Yeah.
states that
How
European
many-
Union,
yeah.
European Union recommend bulbs to eat
Oh,
because it's
what kinds of
high
what kind of
protein
bugs?
high protein
and easy to raise.
Easy to play.
Then other animals like cows or pigs.
I heard that. Okay, you're talking about nutritional value.
Yes.
Alright.
Okay, let's see how it works.
Becomes sticky.
Yes, Doctor, please help me very, very much. You are the only one who can help me. Okay, sir. I actually think that you don't have any parasites on your body whatsoever, and that's all in your mind. You have something called delusions of parasitosis. I can't treat you with anything to kill the parasites, but I can treat you with a antipsychotic type drug to decrease the appearance of the parasites internally in your mind, to make them less noticeable. But to you, they'll probably still be there. Doctor, what do you mean? I have had lice for the past 2 years. You must give me a medicine to kill the lice, yes? Unfortunately, I told you that you actually don't have lice and you have delusions of parasitosis. Doctor, you are a very bad doctor. Here, I am going to the internet to write a bad review about you. You have been terrible and did not make help out to me.
That's happening.
Bye-bye.
What do you think? It is effective? Do you still think it is effective?
Confrontation.
Confrontation. No, I don't know. The guy is so stubborn. He said, "You're a bad doctor."
But it's mental.
He's mental, for sure.
But you have to tell him
Yeah.
the truth.
Yeah.
Sometimes truth hurts.
Yeah.
Yeah.
He's not going to believe you, but you have to tell him.
There's another way, therapeutic alliances.
What does that mean?
It takes some
Refer
time.
to a psychiatrist.
Oh no, before that,
Alliance, like enemies.
trying to form trusting patient relationship.
Okay. And betray sometimes.
And the comfort. Actually,
After you become friends,
it's between friends and friends.
That's not me.
lying to you this whole time. That always works in the movies. So.
Let's see.
Look there, you are the only one who can help me. Please make a help on to me. Okay, I think you have a very complex problem, and I think we may need several visits in order to work this out. I'm going to do my very best to help you. Thank you very much. I knew I could count on you, Doctor.
Doctor.
You brought me this
Russian.
rice or rice droppings, and I'd like to examine it very carefully under the microscope. It's going to take me 2 to 3 hours to examine all of this under the microscope, so I'd like to see you back in a week. This way it'll give me some time to go through this material very carefully under the microscope. Yes, Doctor, I understand. Can you please give me medicine to heal the lice now? Okay, I'm going to prescribe you something called fermental shampoo. Use this as directed, and I'll see you back in 1 week for the day in the clinic, and we'll review the results. Yes, Doctor, thank you very much. After this, the patient will leave. Of course, you're not going to go through this bag of lymph that he brought for you. You're actually going to throw it right in the trash. But when the patient comes back in a week, you'll hear something like this. Yes, Doctor, I am so glad you are helping me. Please tell me what you found when you examined my specimen under the microscope, yes? So I examined him under the microscope very carefully. I want to tell you I didn't see any lice. What I saw wasn't moving. And I'm not sure if maybe you didn't collect enough specimen, but I wasn't able to find the lice that I was looking for. Doctor, they were there, but this medicine, this shampoo, it helped for maybe 3 or 4 days, but then the lice came back. Okay, let's try this. I'm going to do a small skin biopsy today to see if I can find any evidence of the lice. You tell me the area where you have the most, where you feel it's most infected, or most infested. Yes, Doctor, my arm. I feel my arm and the left has been hurting very much from the lice. Okay, we're going to do a small 2mm biopsy. We do the biopsy. Yes, Doctor. Can you tell me the result now? The result won't be ready for maybe another week. Why don't you come back in a week? I'll tell you the
Money! Free money!
And you have the result of the skin biopsy, which is normal.
Alright.
Look there. Please tell me a result of biopsy. Please help me out. As time goes by, you're building a trusting Dr.
Oh, no.
His money. He's not gonna trust you after you take all his money.
Which way do you prefer? Which way?
Number 2.
One.
Number 2, man, money. You're not
I'm
doctor.
not a doctor. As a patient, I would prefer just give it to me straight. Am I crazy or not? Don't take any more of my money.
It's not that expensive in Korea.
Because if I'm crazy, I'm gonna have to do a lot of therapy. So I need to save my money.
Yeah. In that case, patient knows doctor did everything he can. He examined the specimen, plastic bag under the microscope, and he gave fermentory shampoo to kill the lice. and also he did skin biopsy.
So does there any anti-cyclomycin works for this?
Can you split like
Yeah.
Yeah,
drugs right there.
Just give them
The
a
only treatment is
drug and say it's for life.
antipsychotic.
As I know, the usual antipsychotics can work for delusional disorders, but works in this
What works then? Alcohol?
Here is a only one.
Alcohol.
Drugs and alcohol.
A little more.
That's what works for the addicts anyway.
There is a controversy how to treat this patient. Approach number 1, approach number 2. Some doctors use approach number 1, and some doctors use.
I'll definitely use number 1.
You're gonna get
Bothersome.
Yeah.
That the patient's bothersome.
Yeah.
Yes, doctor.
Yeah.
No, it's not yes. Yes, doctor.
So you just want their
Number
let
one.
their
Number one.
patients go.
Yeah.
Go away.
Go see another doctor.
Not much different.
Yeah.
But that comment is
Yeah.
You can just write the reply answer to their bad review. This patient is has delusion of parasitosis. He's annoying his pronunciation.
Yeah, but then you get sued because you reveal
Yeah.
his diagnosis.
Really?
Yeah.
Or I can keep my anonymity.
Yeah.
Or,
Under an alias.
as they're saying I'm their patient.
I overheard that.
Dr. Pajama.
I like the patient.
Dr. Spetchman. Spelled spaceman.
If you take number 2, approach number 2, you will have to do some minor procedures, and also you have to prescribe the medicine. You know it didn't work, it will not work, and
That's unethical.
Yeah. See?
yeah,
You
and
go to
you have
jail
to
for
be
that.
uncomfortable with placebo medicine and placebo
Yeah.
Treatment.
And in the end, you still have to tell them the truth, right?
Yeah.
Yes.
Yeah.
yes.
So.
Okay.
You can take money before you.
Or you can just tell them there's nothing I can do because I've tried everything for lice.
Yeah.
And if it's really lice, there's
super
nothing
nice.
anyone can ever do.
Mhm.
Are you sure it's not?
Can't you just say, I want to refer you to this other doctor who's actually a psychologist, but don't tell him he's a psychologist. Say he's another doctor. He wants to interview you, and then the doctor can talk to him.
And confront.
Yeah, and he can
That's
confront. So you can passive aggressively push him off to your psychologist friend.
So that he gets the bad comments.
push him to Marcel. Marcel!
Yeah, Marcel.
We need your help! No!
Yes, doctor.
Yes, doctor. Is he parasite specialist? No way.
Yeah. We have Marcel, yes.
Yeah.
Yeah, you can refer.
Yeah, yes.
Dr. Marcel will help you.
So check him in. Check him into the hospital.
But what if Marcel refuse the patient?
He gets the bad comments. In the internet. Bad doctor. From me.
That's right, and then you don't have to worry about it. So it's that's
Clean hands.
yeah, exactly.
But it's important to say, before telling the truth, it is important to say, I've done everything I can, and I've prescribed every treatment, all the treatment I know.
Oh, you don't know.
And now, okay,
You're not capable.
I don't think you actually I don't think you actually have parasites.
I have had
For 2 years. It's a vicious cycle.
doctors who are usually more capable of treatment. Diagnosed me with
There's
parasitosis.
it happens in Korea too, right?
Yeah, probably yeah.
There are a lot of
Because
grades.
what is it? To see the doctor, it doesn't cost much in Korea.
Yeah, yeah.
So when I was in Gumi,
Mhm.
in the ER, there's this guy who comes there every day,
Oh yeah.
and he's in the he doesn't have to pay the health insurance
Right.
Why?
because he's poor.
Oh.
What's 급여?
Oh.
What's the 급여? What's the term? You
Pension?
learn that in medical law.
Well,
I mean,
he's
he
on
uses the welfare. Yeah, he doesn't have to pay. He
Yeah.
doesn't pay anything at all.
Every
He
day.
comes there every
Yeah.
day, asks for prescription for drugs,
Prescription for what? What is his symptom?
For headache.
for headache, for
For
stomachache,
Yeah.
for nausea.
always something.
Okay.
He needs attention. He needs love.
Hypochondria.
Yeah,
He needs
Phone calls
love.
and
he comes there every day.
Um,
So the nurses and the doctors, they
Love.
don't oh, here's bad.
Oh, not again. Oh, him again.
Here's something.
I don't think we can expect high success treatment. Like,
Just get money from them. They're willing to pay.
usually they insist their treat symptoms
Yeah, they-
despite of their evidence. I guess.
When I was in high school, one of my teachers, or middle school, high school, my teacher was hypochondriac. Every week she had a different brace. One she'd come with neck brace. Next week her arm is in a sling. Next week she has crutches. Every week, all year. It was really crazy. Really weird. Had to
She
be
has
something.
multiple kinds.
Yes.
Every week.
Or maybe
Yeah.
bones breaking. Osteoporosis?
Maybe, but her personality also seemed kind of crazy too. So I would probably guess closer to the hypochondria because of her personality.
Oh.
Maybe that's kind of
Really
kind of
strange.
factitious disorders.
Oh, is it different?
Yeah,
Is
yeah.
it different?
She wants
If
something
you,
else.
If you have some
Mhm.
factitious disorder, it means that
Fictitious?
Factitious, yes.
you
Factitious?
you're aware
Oh.
of your symptoms are fake.
Oh, see, okay.
In case of
So she
hypochondriasis,
knows it's fake. She's
Yeah.
just doing it for attention.
Mm.
Ah,
Oh yeah,
okay.
I've seen that from Dr. House. There was one patient who would go from hospital to hospital with
Mhm.
no, like, she
Yeah.
actually gets some of the drugs to induce some
Mhm.
symptoms, and she gets admitted, and everyone's like been sending her away. Like she doesn't really have a symptom, but she's like really lonely.
Yeah.
Like it's a form of like psychological
Give attention. Yeah.
sort of. But
Interesting.
Dr. House apparently found an actual medical condition that she had. Because all the doctors, they would not really examine her because
Yeah.
they know that she has a history of that.
Yeah.
So it's like, oh, she's just making it up. And then,
He finally found one. She must have been so happy.
and then she got really scared that like she actually had some
Yeah.
debilitating disease. So she's like, I don't want to be sick anymore. Just
Yeah.
treat me. But then again, after she got back like better,
Uh-huh.
she used the method that Dr. House used to admit her.
Oh,
Because
okay.
the hospital wouldn't admit her, right? So she just got that and then like started doing that. Like, oh, no, girl, you need to go see a shrink. It's kind of bad.
Okay. What is treatment? No doubt, antipsychotic medication.
Would antipsychotic medication work?
Yes, more because it's a delusion.
It's a delusion.
So if they take it, they won't have like all these symptoms, so it'll go away.
I don't think that's all successful because it's not real psychosis. It's, so usually you can use actually this kind of only medications for
Yeah, that's the only medication that's why we
psychosis, but it's not that useful. They're not really crazy.
Yeah, they're no more other
They're
than that.
just normal other than symptoms.
Yeah.
I know that I know a lady who had some physical signs like headache. She had a severe headache and nausea, and she wasn't pregnant. She wasn't doing any strenuous exercise, and she wasn't taking anything. She went to like several different doctors, and nothing worked. No painkillers could get rid of her headache. And this one doctor, her father's friend, was examining her and taking her history, and she's like, let me give you some medication. I think this might help you. And then she had that, the headache was gone. So she came back asking him, what did you give me? It worked. And then he started yelling at her. It's like, how could you do this to yourself? And she's like, what is it? It's like, it was antipsychotic medication.
Yeah.
So Sometimes it works, I heard. So I thought maybe it's one of those cases. So you just take it and then the lights goes on.
So in this case, it is not easy to convince patients to take antipsychotic medication.
Yeah, you should do what that doctor did.
Yeah.
Take this.
It's hard. So I think the most important thing to treat this patient
I
is
think it would be better to
strong therapy relationship and also
drugs, cyanide.
reassurance.
Nice rapport.
Patient can be helped. So the reason why I choose this topic is to emphasize the good patient-doctor relationship.
The patient's on cyanide. 2 cc cyanide step. Shut up!